Okay, we're up to adolescence. Adolescence is that period of rapid growth that causes major physiological changes. Bones grow and gain density, muscle and fat tissue develop, and blood volume increases. Adolescents typically have enormous appetites, and if they have established good eating habits early in life, they tend and nutritious food is available. They tend to have good food habits with no problems. Of course, there is that tendency for peer pressure to be there, and sometimes those good eating habits are forgotten. Many times, adolescents skip breakfast, sometimes lunch also, and then want to eat fast food later. Many times, also, adolescents have a problem with body image, and they often compare their bodies to those of their peers, and they may restrict food intake, which leads to inadequate nutritional intake as well. Um, in order to help adolescents prevent eating disorders, you need to encourage healthy dietary habits and adequate exercise, emphasize a healthy lifestyle over physical appearance and weight loss, encourage increased self esteem and stress positive self worth, avoid pressuring children to achieve perfection or beyond their abilities, and then recognize the signs and symptoms of eating disorders and seek professional help when suspected. So, all of those things are important also when you're dealing with adolescents. Um, Typically, adolescents' rapid growth and their kilocalories are increased. Boys require more kilocalories than girls because they tend to be bigger and they have more lean muscle mass. Except for vitamin D, nutrients are increased dramatically. Nutrient needs are increased dramatically. Because of menstruation, girls need more iron than boys do. And that is about it for adolescence. Young adulthood is approximately from 18 to 40 years of age. It's the time period when you have boundless energy for all the social and professional activities, and they're usually interested in exercise for its own sake. Middle adulthood ranges from 40 to 65. It's the time when physical activities typically decrease and they have lower kilocalorie requirements then. Middle aged people may tire more easily than they did when they were younger. They may not get as much exercise. Um, Food and appetite do not decrease though, so sometimes this is a tendency to gain weight during this time period. Physical growth, though, is usually complete by age 25. So, except during pregnancy and lactation, essential nutrients are needed to only maintain and repair body tissue and produce energy. During this time, iron requirements for women throughout the childbearing years is higher than that of men, and then after menopause, this requirement matches that of men. The kilocalorie requirement begins to diminish after about age 25, and those who are more active will require more kilocalories than those with a higher proportion of fat tissue. Older adulthood has many physical changes that affect nutrition. The body's functions begin to slow. Its ability to replace worn cells diminishes. The metabolic rate slows. Bones become less dense. There's less lean muscle mass. The eyes don't focus as well as they did. Sometimes there's poor dentition. The heart and kidneys become less efficient, and hearing, taste, and smell also are less acute. Digestion is affected. The tone of the intestines is reduced, possibly resulting in constipation or sometimes in diarrhea. Healthy eating habits that were there throughout life, an exercise program suited to the age, and enjoyable social activities can prevent or delay those physical deteriorations and depressions. Nutrition and lifestyle should be carefully reviewed for those elderly folks. And then you have to be aware of food drug interactions, forum and drug interactions as well. These interactions could affect both the appetite and the absorption of nutrients. In general, most elderly people decrease their activity, so their kilocalorie needs are also decreased. They gain weight. If they gain weight, it increases the work of the heart and puts extra stress on the skeletal system then. If they have an exercise plan that's appropriate, it can be helpful in burning the excess calorie and in toning and strengthening muscles. Now, you have to take special considerations for the elderly. Remember water. Make sure you pay special attention to water needs. Regardless of physical activity, They need to be reminded sometimes to drink or be offered water more often because that thirst mechanism is less responsive than it is than in younger people. Um, Sometimes they're bedridden and immobilized, and they need a further reduction in those kilocalories. They should be limiting the amounts of empty calories, such as sweets, sugars, fats, oils, and alcohol. You need to make sure that they have an adequate consumption of unsaturated fats that give them a source of energy. And then you need to select carbohydrates as follows. Again, limiting the concentrated sweets, using moderate amounts of simple sugars, and most of the sources should come from complex carbohydrates such as fruits, vegetables, cereals, and breads. You have to make sure that they have adequate amounts of vitamin D, calcium, and phosphorus to maintain good bone integrity. They need to be encouraged to consume high fiber foods such as dry fruits, whole grain cereals, nuts, fresh fruit, and vegetables. This increases satiety, and maintains intestinal mobility and thereby prevents constipation. They should also have adequate intakes of sodium, but avoid canned foods, salted or cured meats because of cardiac problems and hypertension. Go back a second to food-drug interactions with the elderly people. Dairy products should not be consumed within 2 hours of taking an antibiotic or the drug's not absorbed. If they're taking a blood clot-reducing agent such as Coumadin, they must consume iron-rich foods in moderation because this counteracts the blood thinners. Vitamin supplements can also cause interactions. The antioxidant vitamins are not to be taken with blood clot-reducing medications because they have a tendency to thin the blood. So you have to remember all those things when you're dealing with the elderly. Okay, pregnancy and lactation. Good nutrition during the 30 to 40 weeks of normal pregnancy is essential for both the mom and the fetus. Most pregnant women must provide nutrients and kilocalories for the fetus, the amniotic fluid, the placenta, and the increased blood volume in breast, uterine, and fat tissue. An adequate diet. The pregnant woman is more apt to feel better, retain her health, and bear a healthy infant. Also, if she consumed a nutritious diet before pregnancy, she's more apt to bear a healthy infant than one who does not. Malnutrition of the mom is believed to cause growth and mental retardation in the fetus. Infants with a low birth weight that's less than 5.5 pounds tend to have a higher mortality rate than those with normal birth weights. There is not a need for increased kilocalories during the first 12 weeks of pregnancy. After that time, mom needs an extra 300 kilocalories per day, and this is almost completely accomplished by just 2 extra 8-ounce glasses of 2% milk, which gives an extra 240 kilocalories. Folic acid and iron needs are increased during pregnancy. Folic acid is necessary to prevent neural tube deformities in the fetus. It's approved as a good supplement for pregnant women, and good sources of folic acid are beef, legumes, wheat germ, and eggs. Iron is available in red meat, dried fruit, egg yolks, and whole grain products as well. It's not advisable for the mom to take any unprescribed nutrient supplement. Unprescribed, that's the key. If the doctor recommends it, then she needs it. Because, for example, excessive vitamin A can cause birth defects. Kilocalorie needs are also increased during lactation. During the first 6 months, daily milk production is about 750 mils, and for this amount of milk production, mom needs an extra 640 kilocalories per day. During the second 6 months, when the baby begins to eat food in addition to breast milk, the average daily milk production slows to about 600 mils per day, and the kilocalorie requirements are only approximately 510 kilocalories per day at that time. We're going to skip over now to overweight. You're considered to be overweight if you're 11 to 19% above your desired body weight. Obesity is present in anyone that's 20% or more above the desired body weight. There are health hazards for being overweight. There's increased strain on the heart, lungs, muscles, bones, and joints. Also, overweight and obese people are more susceptible to diabetes, hypertension, and tend to have a shorter life expectancy. Obesity is a major problem in the U.S. at this time. There is no single cause. Genetics, physiologic, biochemical, and psychological factors all contribute to overweight conditions. More often, being overweight or obese is an energy imbalance. That is, there are more kilocalories taken in than are being used. This means that the body stores those excess kilocalories in adipose tissue. Occasionally, hypothyroidism is a possible cause of being obese. Now, treatment for obese people is divided into two parts: revised eating habits and exercise. The revised eating habits include reducing the daily kilocalorie intake, limiting between meal snacks to fresh fruits or vegetables, and restricting or eliminating empty calories completely. So 1 pound of body weight equals 3,500 kilocalories. So if someone wants to lose a pound a week, they have to reduce their kilocalorie intake by 500 kilocalories a day. Weight loss should be limited to 1 to 2 pounds a week. People who are trying to lose weight also need to pay attention to their food preparation. Frying adds kilocalories to the food, so they should choose to broil, grill, bake, roast, boil, or poach. Vegetables should be eaten raw or steamed, because again, you retain those vitamins and minerals if you steam them or cook them in as very little water as possible. And the addition of butter, margarine, and sauces should be avoided. You can also accomplish this by eating on smaller plates, cutting the food into smaller bites, chewing each bite at least 12 times, and putting your fork down between bites. Now, the second part of treatment for overweight people is exercise, especially aerobic. Aerobic exercises uses the energy from the body's fat reserves. You can accomplish this through dancing, jogging, cycling, skiing, rowing, and power walking. Any exercise program must begin slowly and increase over time so that there's no physical damage. Now, people can also be underweight, and that's when they're 10 to 15% below their desired body weight. They're more likely to have nutritional deficiencies because of decreased food intake. For women, this can cause problems during pregnancy. And also, being underweight can have a lower resistance to infection. Being severely underweight can cause death. There are causes for being underweight, and those are inadequate intake of food, excessive exercise, poor absorption of nutrients, or severe infection. Occasionally, hyperthyroidism is a cause of being severely underweight. So the treatment for being underweight is to gradually increase the amount of food eaten. Also, higher kilocalorie foods can be eaten. Between meal snacks and bedtime snacks can be added. If they wanted to gain 1 pound a week, they'd have to have an extra 500 kilocalories a day. The diet cannot be immediately accepted into the full kilocalorie value. It has to be done gradually, and they should increase the foods that are rich in carbs, some fats, and proteins.